how do I change the how we look here?
What do you mean?
Can I see other people, or can I can't tell me very well. Should I?
Yes, so you can do speaker view or gallery view up
Yeah.
on the top. And then everyone so far has their cameras off, so you should just see me and you.
Yeah.
Good
Hello.
afternoon,
Oh,
everyone.
shoot. Okay. Good afternoon, everybody. I guess I realize I'm sitting here waiting for somebody to respond to me because I'm used to us all being in the room together when we have conferences and that sort of thing. So there's the first impact of COVID on my thinking. How about that? Okay. So my name is George Dix, and my daytime job is I work at Harborview Mental Health Services, where I specialize in geriatric psychiatry. I'm not a psychiatrist. I'm a case manager and a therapist and a community educator, and particularly focused on the well-being of my African American fellows and the addressing the long history of need, and specifically in the healthcare field, the experience of healthcare disparities. That is, folks in our community suffer many illnesses, and the ones we're going to talk about today is mental health, mental illness, and specifically depression in older adults. And in the context in this situation of the impact of COVID, which is only one of many factors that are driving the high level of depression in the African American community, high level of stress. I want us to relate to that word, stress. I want all of us who are not older adults, who are working with older adults, even if you're teenagers, we're all experiencing a major amount of stress. I want to say over the last year when COVID has been a part of our lives, but you and I know that the stressors that we are all experiencing have far exceed this last year. And I'm going to include gentrification, because this is another major disease, I'm going to call it that, that impacts the African American community. The stigma of mental illness that prevents most older adults, and particularly African American older adults, from assessing for mental illness, assessing for depression. Stigma, which has influenced our own communities, limited understanding, and placing the proper importance on the behaviors that I'll talk about that are indicative of depression. And again, we live in a community that is long suffering. We are survivors of centuries of trauma, of stress, and we've learned to thrive in spite of it. So I want us to not leave today without some strategies for making things better. So let me just give you a general overview. I'll talk again about what depression is in older adults, some of the major contributing factors in the context of COVID, and some interventions. And what I'd really like, again, as I started out with sort of waiting for someone to interact with me, I want to let you know we're looking for your questions and your concerns through the chat boxes. And that's how we'll, at various points, ask what the questions are that are focused, that are your concern, and I'll address those. And so anyway, be thinking as we talk. Again, I'm not used to just blathering on, but I am today. So anyway, so let's start out with what I'm referencing. First of all, Again, I work with research organizations. I am particularly involved with the University of Washington's Health Promotion Research Center, in which we focus on health promotion. That is an attempt to address the chronic diseases. So there are several major chronic diseases, and I want to say we also address the disparities. What are disparities? Disparities are if you take 100 people and you decide how many of them have this or that or the other, that'll give you a percentage of of a disease in that population of 100. So you project that out to the whole community of African Americans. And we have certain rates of health disparity. That is, we have more diseases in certain areas than other folks, particularly our European Caucasian counterparts. Some of the statistics I'll share with you and some of the comments are also true for what we are now calling the BIPOC community. That is Black, Indigenous, and other people of color. That also includes other disenfranchised groups such as the LGBTQ community and the disabled community. I want us to keep in mind those people we see in wheelchairs and with other kinds of disabilities are very much discriminated against in the same ways that Black folks are. That is, when you see someone, think, how do you perceive them from afar? What implicit biases you have are operating? Why do you have this impression of a person that you don't know anything about? Well, this is one of the biggest challenges that we have in the healthcare profession is addressing unrecognized bias. And we are all raised with bias. We are all Americans, and we've been taught certain images of what is good, what is right, what is bad. We have a vocabulary that constantly reinforces our thinking. Black is a good word since 1968, when my fellow Augustin James Brown brought out this wonderful song, "I'm Black and I'm Proud." Okay. Of course, we all, many Black folks, recognize the power and the joy and the beauty and the tremendous intelligence and survivability of being Black in America before that. But that was not by any means transmitted well over the centuries. And so I'm here to reinforce that you are a survivor. You're a strong person. You have dealt with many challenges over the years, and you're resourceful. And I'm here to share that some more resources with you as we attempt to take care of our elders, our very important elders, these valuable people who carry the history of our community, the history of our family lineage. They are important role models of survival. All of that is really important. They sustain the community institutions like the churches, the sororities, the clubs, the hangout on the block. They are the centers of those really important community resources, many of which are being severely limited by this COVID-19 situation. So I'm going to read to you just briefly, I don't want to make it up, what's going on in our community response to COVID. So African Americans are far more likely than to contract the COVID virus and to be hospitalized for it and to die as a result of it, and as compared to other groups. And there are many psychosocial, sociological, and environmental factors that contribute to that. And so we'll look at some of those factors. And here's the other thing. This is another form of disparity, the lack of trust that we have in research institutions, in mandates from the government. And I'll just use the word Tuskegee, because everybody knows what that means and what that implies, that Black people have been used in research inappropriately and been maltreated in practice of medical provision. But there were other examples of that, various disparate, again, research on Black women that form the basis for modern obstetrics. I'm sure that you're aware of some of those, again, examples of how African American bodies have been misused. And so we all have legitimate reason to be skeptical of anything that's presented in general, and especially that's invasive. That is, this vaccine you shoot into your body. And again, let me tie that into the disparities issue. So, excuse me, the chronic illnesses. So the major chronic illnesses out there that affect particularly older adults are diabetes, hypertension, high blood pressure, cancer, arthritis. So you think about those disorders. Do you know anyone who has those disorders? Of course you do, because again, if you take 100 people, 100 African Americans, they have more of those folks will have these chronic diseases than other counterparts in our population, particularly significantly less than our European American counterparts. So this is throughout the lifespan. African Americans tend to have these diseases, develop these diseases at a higher rate. Chronic diseases, you don't die from them right away, but they make life challenging. They make life uncomfortable and difficult. They make life expensive. And depression is one of those disorders. And so I want us to keep in mind that is depression is a disease. It's not just feeling bad. And but I do want to make a couple of distinctions here. Depression is higher among older adults. I want you to just imagine over the lifespan, you've experienced a lot of things. You've experienced a lot of losses. Okay. I've had chance to develop hypertension. I'm now 70. I've had a chance to develop hypertension. I have successfully been treated for cancer a couple of times. So that's sort of in the back of my mind. So there's two of the chronic diseases right there. And I'm pretty healthy, all things considered. I know how to take care of myself. I have access to resources. I have an adequate income. I don't live in a neighborhood that's particularly polluted or overburdened. And yet the lifelong stress of the day-to-day challenges of being African American is a significant wearing, corrosive factor in all our lives. So what does that mean? I'm here about mental health. I'm here about thinking. So depression, anger, confrontation, the anxiety that seeing a police car in your rearview mirror, the constant drumbeat of racist diatribes, seeing people being treated differently for their behavior than you would be, the constant random encounters that result in microaggressions, stupid things people say. All of those things we weather and we take and we deal with. And what that does is create anxiety, stress. And I want this to be the real thing you take away. It's making bad chemicals in your brain. It's making bad chemicals in your body. It's making you carry a burden that others may not. It gives you a fairly negative perception of the world if you are vulnerable to and sensitive to depression. I want to make sure that we all understand that from time to time, all of us do get sad. We've all had experiences. I want you to know that that's normal. Okay. I want you to really think about normal depression or reactive depression. That is, there's an event that triggers this sad response, okay? And the classic is grief, 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 grief of our loved ones when someone important in our life passes away or moves. That can be a pet, definitely can be a pet. It's not just loved ones. When I say loved ones, it's not other humans. The loss of a job, especially in these times where people are unable to go to work because of the danger, or because, as in the example of the restaurant and hospitality community, those jobs have gone away because those businesses are closed down. Well, who is doing those jobs? Persons of color, very heavily, and therefore our communities are impacted. That means I, who work at Harborview and the University of Washington, I got my 2 shots already. I got my 2 vaccines. I'm in a system that promotes that. I'm in a healthcare system. So many of you are not. And even if some of you work, for example, in nursing homes or other kinds of care settings, you may or may not be prioritized. And I'm not only talking about, again, people who are hands-on healthcare providers. I'm talking about people who work in the environmental services, the janitors. I'm working about people who work in the laundry, in the kitchen. All of those people are at risk for exposure to this very virulent and deadly disease. I'm concerned about, as bad as it already is, the stigma of these, the new virus mutations. Black folks have always had to deal with stigma. That is, assumptions about us that are stereotypes that are and assumptions about us that are wrong, that have very little basis in reality, and certainly are not true, and certainly don't generalize. But we all live with that. And so when the South African variant of this virus comes out, I'm concerned that that's going to now again further somehow be associated with Black folks. You know that? You know how this goes. Again, it's already impacted tremendously the Chinese and Asian community, these stereotypes and misunderstandings. So this situation with COVID is quite real and quite daunting. So it's resulted in lower employment. Black folks, as a result in Seattle of gentrification, especially older African Americans, have been dispersed. And so those institutions that are still healthy and still provide important supportive services to our older adults are still located in our traditional central area. And I'll reference the Central Area Senior Center or Southeast Senior Center on Rainier Avenue. Those are the places where I think Black folks of a certain age would anticipate getting information about this disorder and seeking, perhaps expecting to be able to find a vaccine site at those services, or certainly someone who can assist them in getting to accessible vaccine sites. Well, that is a real challenge now that our population has been dispersed. And also the chaotic and inadequate rollout of the vaccines have prevented people who are trying to get vaccinated all over this city from getting predictable and reliable service in that regard. So these are really powerful constraints that stress younger people, and they really stress older people. So I want to really now shift our attention to what does it mean to be depressed? What do these words mean? So I think we all can relate to sadness. Okay, that feeling of not of sadness, of the blues, of despair, of hopelessness. Okay, and so we see that in the expression of people who have depression. Unexplained and aggravated aches and pains. This is one of the ugly truths about depression in older adults. It makes those illnesses, those discomforts worse, because depression causes us to focus on the very negative things in our life. That's part of depression, is we're running the same negative tape over and over and over. You know, when you wake up in the middle of the night with that thought on your mind that you can't shake, that's depression. That is depression. And it's hard to get out of that rut. Okay, so that contributes again to those bad chemicals that are happening in your brain, and that makes the pain into suffering. I make a distinction between pain and suffering. Suffering is how you deal with it. Are you preoccupied with it? Do you go and take your medicine? Do you feel like there's no hope for this condition? Uh, those are the challenges of those kinds of situations, of aggravated aches and pains that are further exacerbated by the sadness, by the loss of socialization that distracts us. When I'm on the phone with my buddies, when I used to be able to go out and get coffee with Pete, and go to the park, uh, go and play basketball with my kid down at Pratt Park, um, you know, not having to think about who I'm sitting next to, how far away I am from somebody, whether I'm wearing my mask or not. All of those things are now intrusive thoughts into my life, and they make life for all of us more complicated. And those things that I mentioned that used to nurture me are harder to find. So I want you to be thinking about, what are the things that I do now that will help, that will continue to be healthy, productive, that make me laugh. So again, it's distinction between grief and depression. People who are grieving, they will have moments. I think when we've lost someone, I can reflect on the good things that I remember about that person, the funny times that me and Bob and Roger used to have. I recently lost the second of my two best friends. Uh, and there's stories I won't ever be able to tell anymore, because only Bob and Roger and I knew those. And now they're both gone. And so there's an avenue of my life that is now sort of walled up, except for those things and those moments that can trigger my own reflection of that. But that's also marking for me a step along the path. So sometimes fear of death is on the mind of our seniors. And I think that in a healthy way, that drives us to spiritual exploration. It drives us to life review, which is something that as a therapist, I'm really focused on. That is examining, what have you done with your life? What were you proud of? What did you enjoy? What made you laugh? What did you fear? What do you think of as the successes that you had? Uh, those are things that I want people to remember, because in those things are the strengths and the attributes that will allow them to functionally deal with depression. So I don't want to overemphasize, and I won't, the use of medication, for example. That's very important. But I'm going to say this very clearly, because it's a department that I work in, and this is my little corner of the world. You need to see a geriatric specialist. You wouldn't take your kid to just any doctor. You take your kid to a pediatrician, because the body of a kid is different than the body of a 40-year-old. By the same token, once you're past 60, your body is different again. And it significantly needs to be seen by someone who understands the particular changes that are expected, the particular changes that can happen. And when something, again, particularly those chronic diseases, hypertension, arthritis, cancer, diabetes, that's the big one for me. That is the big one. And again, cancer, other things. It's really important that you have someone who knows what they're looking at and have seen it before, and in many cases. And so there are geriatric providers here at Harborview, which again is perhaps the largest provider of services to medical services to our community in general, but Northwest Hospital, University of Washington Hospital, all of those places have significant psychiatric services that are oriented to helping older adults deal with the transitions that happen in age, with aging. So one of the models that we say about aging in terms of treatment is that we're always learning to compensate for the losses that we have over time. So typical things happen. Uh, I wear glasses now because my eyesight has deteriorated. Eyesight deterioration is normal if you live to be a certain age. It has certain predictable characteristics. And so it's not a big deal. We just go get glasses and learn to live with those, and we are able to function. Uh, Depression is very powerful and can prevent people from functioning. It can cause withdrawal, significant social withdrawal. And that's doubly compounded now by the COVID situation that forces us into quarantine and to limit our socialization and our access to other resources like safely walking in the neighborhood. I prefer to walk in the park, but the parks are closed. And so that's really limited my activity level. So what happens then using that example? Well, I don't know if you noticed that there's something called COVID-15. And that's the 15 pounds everybody's gained in the last year because we're more sedentary. Being more sedentary in general, our muscles are weaker. And that's what I'm really aware of. And I got to get off my tail and start doing more push-ups. I just have to do it. I hate push-ups, but I have to do it because I can see that I am what we call developing debility. That is, I'm losing some muscle mass, and it's going to be hard to get that muscle mass back because I'm 70 now. And that is also a normal part of aging, to lose muscle mass. But if we stay vigorous and active, we can maintain that and thus our overall health. It's also a factor that my increased sedentary nature, me sitting around watching TV, it's also having a cognitive effect. So I'm really glad that I still have to go to work. I still get that social stimulation. I get that mental stimulation of doing something, being challenged by the situations that come up in a clinical setting. I'm still engaged in community-based activities like this, and that keeps my brain working. I want to encourage you to do the same thing, to find what are those activities that engage you, that turn you on, that make you interested, that make you laugh. So those things are making good chemicals. Okay, so I want you to know that worry, anxiety, all of that stuff, sleeplessness, that makes bad chemicals. Okay, and our goal is to have good chemicals because they contribute to our longevity. They reduce our risk of Alzheimer's and other forms of dementia. We are role models for those little guys that are watching us, those young men and women who have yet to take this journey that you and I have successfully mastered. And that's the other thing, to be good stewards of the family. So I just want to really encourage all of us to focus on things that contribute to our positive emotion. So again, let me go over the signs and symptoms in older adults. Sadness and feelings of despair, unexplained or exaggerated aches and pains, loss of interest in socializing and hobbies. And this is something very important. Loss of weight and appetite for some of us. For others of us, we're going to eat and eat and eat. We're going to overeat and gain weight. And that weight gain is going to make us more sedentary, right? Okay. So be mindful of those things. That's why, again, this COVID-15, as I'm calling it, that is another way of increasing depression. The feelings of hopelessness and helplessness. I was talking about life review, getting people to talk about things. Uh, when we hold this stuff in our head, one of the ideas about therapy is getting this stuff out and getting it into perspective and bouncing it off another person. That makes things much more manageable. It's you can start to eat the elephant, i.e., one bite at a time. Take it apart, take the problem apart. But at 4 o'clock in the morning, when you're lying in bed and this stuff is going around and around in your head, that is a waste of, that is just draining energy from you. So, unfortunately, one of the major consequences of depression is sleep problems. And like eating, it goes both ways. You can be really sleep deprived, which really is a miserable condition for anybody who's ever had that experience. And or you can sleep and find it hard to get out of bed. And that's another classic symptom of depression. So sleep disturbance. Now, I want to say this too about some of these things I'm mentioning. There are other reasons besides depression for some of these illnesses, for these conditions. And so that's where it's important to do your research either. And I mentioned the internet because that's a tendency we're going to have as the future. There, it's more and more a part of our life. But let me say this: go to the good sites. So Medline, MedMD, WebMD, Mayo Clinic, the national, you and I are taxpayers. We have funded some tremendous organizations like the CDC and the National Institutes of Health and of Mental Health. Go to those sites. They give you the real stuff, okay? And without any other agenda. And again, this is what we as people, as taxpayers, have paid for. Yeah. A sense of loss of self-worth. So this is a real challenge, I think, to when people find themselves prematurely retired or bumped out of work because of the circumstances that we're all dealing with right now. That sense of worth, your ability you've been providing for your family, and now you can't. Again, you've been able to be home with your kid and now you can't. So that's a result of the economic pressures. And those are often aligned to our preparation, our educational backgrounds, what our community is willing to employ us for. A lot of factors go into self-worth. Many of us, most of us, may not get our self-worth from our job. I'm always really struck by this. My granddad, he is my hero, one of my heroes, George Bailey. He was a circuit preacher, and I reference my own spiritual origins with him. But he was also a janitor at a bank, a custodian at Georgia Railroad Bank in Augusta, Georgia. And I know that they didn't know how to value him. He was just a janitor to them. But he was a pillar of the community. He was a leader and a shepherd to several churches. And he was just my spiritual mentor. And so please, we need to honor our seniors. We need to recognize the value they've had to us. We need to continue to support the institutions that support them. Again, like Central Area Senior Center, like Southeast Senior Center, et cetera. We need to honor the leaders of that are taking the initiative to protect us, to always introduce the concerns, make sure that the concerns of the African American community are in front of the policymakers and the people who decide how the money's spent. So again, I will continue to participate in the University of Washington's Health Promotion Research Center and contribute to being a critic and a promoter of the programs that they emphasize, and to see that African Americans and other folks of color, of all colors, 'cause I'm part Indian too, just are all represented, and those concerns are addressed. So I want us all to, like, I think it was earlier this week, there was a short notice, but a pop-up vaccine clinic at Central Area Senior Center. So I hope some of you got down there and got those shots. And I want to thank Winona Hollins-Haig and Diane Ferguson for their whole life commitment and relentless dedication to advocating for this community. And we have other great leaders, and I'll just mention Margaret Bodie, who also, we are on the Health Promotion Research Center together, and she is the current chair of the Citizens Advisory Board. And her deep experience and lifelong dedication to this community informs the policies and procedures that are going on in research at the university. So I want to encourage you to get involved in research, please. I know, and this is the thing about the corona vaccine. I'll just say it right now. You and I all know. I said it. I'm not taking that stuff until I see Joe over here, how he responds to that. Well, I'll tell you this. I mentioned the word anxiety, worry, and stress. When I got my first vaccine, I didn't realize how relieved I was going to feel. I was shocked. I didn't realize I had the anxiety until I got the shot. And then all of a sudden, whoa, I was so glad. and now that I've got the second shot, I feel protected. I'm going to still use my mask because that's appropriate. We don't fully understand everything, but I feel much better. I know that this was not a inappropriate research or somehow not done as rigorously as it would have otherwise been done because of that guy who pushed it, right? Okay. And so another stressor, you and I have spent 4 years listening to this crazy person run things, and it's worn on us. It's worn on us. So I want you to understand, you and I have, all of us have some recovery to do. So again, loss of self-worth. You and I need to remember we are survivors. And in fact, what I've been telling people is you are masters of this game, okay? Especially if you get to be an old person like me, and still be alive. You figured something out. And you young people, y'all need to talk to us about that. Yes, right. So people with depression also, here's one of the issues for our community, or all communities, I wanted to say that. But again, at a higher rate, self-medication with alcohol and other drugs. That's just a reality. I don't have to tell you all about alcoholism. You all know about it, okay? We've all dealt with it in our families, and this would be the same if I was talking to any other group as well. So alcohol is a depressant. So it doesn't help depression. Alcohol affects your brain. It kills your little brain cells. So it's not making you more competent or resilient. Alcohol causes people to be impulsive, make bad choices and decisions, become aggressive, particularly in men. And I say particularly in men, but I don't know. I think you guys know women who can get pretty aggressive when they're under the influence. And I just want to make sure, and it louses up your sleep. So drinking yourself to sleep does not add to sleep quality. It undermines sleep quality. So passing out is not the same as sleeping. Okay, I just want us all to be in touch with that. And again, the myriad of substances that have impacted our community over the years, well, they're bad, and they really haven't. Excuse me. I'll just say it this way: all things in moderation. All things in moderation. And another challenge of depression is memory problems. This is, again, something in older adults that's particularly challenging to decipher. I'll give you a little, sort of a mnemonic to help you remember what is depression versus what might be dementia. First of all, both of them should be diagnosed by a professional person. Don't you and I do that. Don't go to the internet and even and see those symptoms and say, oh, you've got it. No, go to the internet, see those symptoms and say, we need to get this checked out. Okay. And particularly, I want you to know that dementia is not normal aging. And we all have a tendency to want to say, oh, it's just the next stage of, no, because that prevents us from addressing reversible, treatable conditions that might in fact lead to significant dementia. So illnesses of all varieties can contribute to the onset of dementia-like symptoms in older adults. Particularly classic is urinary tract infections. Okay, any kind of infection, upper respiratory infection, any of that can change the way the older adult thinks. So when you have a change in behavior, as they start forgetting more, they misplace items, they become paranoid. What is paranoia? False fear. So when my grandmother got dementia. She loved her daughter Dolores, but she was so sure that Dolores was coming in the house and taking her leather coat. and so that's typical Alzheimer's, is one little goofy thing, and she was preoccupied with that. But it led to her not being able to trust Aunt Dolores. And that was really a big deal since she was like her primary caregiver. Another example was granddaddy. My granddad, he was on his way to my dad's house one day, and he had driven up Wrightsboro Road and turned right for 30 years to go and get his cigarettes or whatever my dad had brought him back from Fort Gordon. One day he went up that road, instead of turning right, he turned left, and we didn't see him for 3 days. And so that freaked us out. And excuse me, that's what happened. That's when families do something. I'm going to tell you, when the crisis happens, so don't feel bad if you haven't done it yet, but when the crisis happens, I hope it's not terrible, and then you'll do something. So that was when my family did something. We found granddaddy 3 days later in his car on a ditch, right? Well, it turned out he didn't have Alzheimer's. He had something called normal pressure hydrocephalus. And we were able to treat that and get a lot of granddaddy back. And he did ultimately progress into a more severe dementia, but that wasn't the cause of his dementia. He didn't have Alzheimer's disease. He had something called normal pressure hydrocephalus. It was treatable, and it allowed him many more years of healthy life, okay? Cogent, functional life. So all these symptoms need to be evaluated by someone who has the expertise to address those concerns, to ferret out what we call differential diagnosis. What is this and what is that? So again, let me go with the causes and how it relates to, and then I'm going to stop and we're going to ask for some questions. So causes of depression, again, health problems, illness and disability, chronic and severe pain, cognitive decline, damage to your body image, and due to surgery. All of those things contribute to the mindset. Loneliness and isolation. So if this is a contributing factor, you can see how COVID has compounded this risk and the severity to seniors, to our African-American seniors. And again, when I add those other factors like gentrification, we all know we live in a racist country, but I don't think I knew how racist it was. I think that's the shock of the last 4 years, and how sustained it is. And how I watch even well-intended people rationalize the behavior of those racists and people. So I think that contributes to our whole community having a sense of estrangement from the mainstream that other folks may not experience. So white folks with COVID don't have that to deal with. Okay. So that's where, again, I hope there's creative energy in our community about how to re-engage and foster community while we're in this terrible time. That's also why I want to really encourage you to get the vaccine so that you can get back to normal life and start reestablishing normal routines. That's something that I haven't mentioned, but the fact that you can't do what you're normally doing, my brain wants to do the same stuff it used to do. And it's because it's been doing it for years, but I can't do those things. And that creates stress, real stress inside my brain. And then what else am I going to do as an alternative to that? So I may not be having as the creative energy that I would have if I wasn't stressed out to come up with those alternative behaviors and practices. So that's why we need to get together. That's why we need to find opportunities to further communicate. Fears. You know, this is as a geriatrician, old age past 60 is a developmental stage. It's not a wasteland. It is the area where we consolidate this journey that we've been on. And we prepare for death. We prepare for death. That's what we're doing. I don't have too many more mountains to climb. I want to use my resources and energy right now to contribute to the well-being of my family. I want to do what's called generativity. I want to contribute to my community. That's why I'm on this thing, and I hope that it's somehow been useful and helpful to you. But this is what gives me a sense of value and worth, is to be a communicator, to particularly share information about mental health and mental illness, and to be recognized by the mainstream as someone to go to when you want to talk to Black folks. Okay. So and those people that I've mentioned, and all of you who are on, you are in that position too. So I just want to make sure that we understand those things. I'm looking at the time, and so I want to address some questions that might have come up. What's come up?
Okay, well, first of all, thank you, George. That was amazing. And thank you all for participating. We have 3 questions in the group chat. So if anyone has a question, just raise your hand and I will unmute you after I read these questions. So the first one is from Rena, and please forgive me if I mispronounced that. So do you mean that the traumas of everyday life can lead to depression?
Yes, but again, most of us, excuse me, everyday life is stressful, okay? And it's whether or not we have the tools to cope with that. And let me say about everyday life, there's nothing like typical. We have a routine, but you know that every encounter you have with a person or a situation is unique, whether that's driving a car or going to the Safeway or whatever. So, and for Black folks, our world has been constructed in a disadvantaged manner. So that's what I'm talking about. So again, what I'm talking about is the negative stereotypes that people encounter, perhaps the occupations that are less lucrative, and that we are particularly, limited. So you've heard the NFL stuff about this week about Black coaches. So those are guys are making millions of bucks, but they still experience the same microaggressions, racism of everyday life. That's right. That's right. So so poor Black folks experience that even more. So yes, everyday life. But now, do all of us get depressed? No. We develop strategies to cope with those things. Mm-hmm. That's right. And we find like-minded people to support us, both allies in the white community, in other communities. of color, I have a Jewish family, I have a Japanese family, all of which are very close to me, you know, and there are other communities that we develop allies in. And, but if you're vulnerable to depression, then particularly the changes related to COVID can contribute to worsening those conditions. And so that's what I really want us to know. Also, let me say this about depression. I didn't mention it as an element of bipolar illness, manic depressive illnesses, but some of the most brilliant, well-known, artistic, intelligent, creative people have suffered major depression, and the conquerors of the world have suffered major depression, and there's a part of me that wants to say that virtually all of them have. If you know somebody whose name was in history, chances are you know someone who was bipolar, and again, depression is a part of that too. So hey, I'm glad you say that, because I don't want you to be stigmatized or to relate to that as a stigma. It's an illness, and it's a condition that needs to be addressed and can be addressed. So again, I don't want us to think of it as like going in a room, closing the door, and there's no way out. Thank you for that question.
Do you see a correlation between the deaths in hospitals of not having the ability to have families or advocates to ensure that their loved one is being taken care of?
I don't think that. That is, that somehow you are neglected because your loved ones aren't there. Now, if you were talking about a nursing home, then I'd say yes. I say get your tail down in that nursing home every day, never tell them when you're coming. And that keeps them on their feet. That is not true in the hospital. The hospitals are highly regulated. There are a lot of people looking over everybody's shoulder. And folks are dedicated. I'm a Harborview person. I want to make you know that the folks at Harborview are dedicated to and have the energy to want to treat people right. And that is a philosophy, a fundamental tenet of us being here. And there are us Black employees and appropriate other European American allies that are vigilant on this topic. So no, I don't think that the hospital is the issue. Other settings, it may be true that you do need to be vigilant, but no, I don't think that that's true in the hospital. Thank you for that question.
Do you have some links that you would suggest in regards to updated and current research?
I've got a wonderful, I'm just going to, you can't see it, but it's the community engagement. Let me put it, simply put, African American and COVID in your search line, and you will get the CDC has an excellent summary of all the issues, including, I didn't touch upon policy issues and clinical issues. There are a lot of other issues that need to be addressed that impact COVID, or result of COVID. So again, right now, the policies that Congress is dealing with, let your congressional representative know how you feel about that. I think that's the thing. Figure out how not to be passive. Figure out how not to be a victim of COVID. I think that's really what I want to encourage all of us to do. Don't just acquiesce to this thing. I know when to wear this mask and when not to. I know how to sit at the other end of the bench from Pete when we're out there with a coffee. Unfortunately, it's dreary right now, but hey, you know what? There are other places you can get together. Learn how to use Zoom. I know church is on Zoom. Come on, you guys. And don't sit there and say, well, it's not like, well, no, it's not like, okay? That's right. Why would you expect it to be like going to church? Okay. So again, this is bad chemicals from what we call negative self-talk. Don't say bad things to yourself. Don't do that. You're just making bad chemicals again. Okay. I don't want you to be unrealistic. I want you to problem solve. I want you to focus on this is George's word, behavior. What can I do?
Mhm.
Not what can I think, but what can I do? I know I can get up off of my tail and walk somewhere, even if it's up and down the steps in the hallway. Okay. I know that I need to do the push-ups. I know I need to do that. And I can't just sit around and say, George, no, I know I need to do it before I take my shower in the morning. Okay. I know I need to do it at a certain time of day. I know I need to set a number. Okay. But if I just say, George, you need to do push-ups, that's nothing. So I want to encourage you all to think of this as just another health challenge, okay? And you have dealt with other challenges. Many of you have stopped smoking.
Mhm.
Let's use that example. Many of you have altered your diet. I made some collard greens this week, and I used turkey instead of pork chops, instead of ham hocks. And you know what? Smoked turkeys taste just as good as those ham hocks. So, but it took me years to get around to it. Okay, so that's what I'm here to do, is encourage you to deal with the inertia. Inertia is that tendency to sit still, and that can be an element of depression too. Is there another question before our time runs out?
I don't see any other questions in the chat box. Does anyone have any questions before I wrap this up for today? You can unmute yourself if you would like,
I hope that it was.
or
I heard somebody.
that was me, sorry.
Oh,
Well, I just want to say thank you because this was very informative, and I especially want to thank you for the part about the stigma that's attached to mental illness. There are so many different levels of mental illness, and
mhm,
sometimes people just want to throw us all in one box
mhm.
and then start. And one of the reasons we don't share is because we don't want people to start treating us
That's
differently.
right. That's right.
And it's the same way when someone gets a diagnosis of cancer.
That's
A
right.
lot of times
That's
they do
right.
not want to share that diagnosis because all the questions that come or the sympathy looks, we're
Yes.
still happy and
Yeah.
joyful.
That's
We,
right.
you can take care of yourself, get your medication, go to
That's
your
right.
therapy, you do that with your diabetes and everything else
That's
in your
right.
life. Handle your mental illness the same way. So I deeply appreciate this. Thank you.
Thank you, Rena. That I couldn't have put it better. It's wonderful to hear your voice, and you are absolutely right. Here's the thing that I try to remind people. Everybody gets a cold, and it doesn't mean you got cancer. So everybody
Yes.
gets mental illness. We all been sad, depressed,
Mm-hmm.
outrageous in our behavior, paranoid. So remember that.
Mm-hmm.
Yeah,
Mm-hmm.
remember how that is. And you don't want somebody to treat you like crap when you're feeling that way. You want to be invited to explore that and help reduce the temperature and the severity of that. Thank
So
you.
here's what I say about it too. Take confidence in your mental illness.
That's right.
Own it, take confidence in it, and be a light for someone else who may not know how to communicate it to the outside world.
Excellent. Thank you.
Thank
You're
you
welcome.
all. Thank
Yes,
you.
thank
I
you.
am going to respect everyone's time and say good afternoon. Have a great weekend. George and I will follow up through your emails. That will also include some information about our future sessions that we will be holding. So everyone, including you, George, enjoy the sunshine as much as you
Yes,
can. And
Thank
remember to
you.
take care of yourself.
Angela,
Yes,
thank
yes.
you so much
God
for your role
bless.
today.
of
Thank you.
course. All
You did
right.
great.
Bye-bye,
Bye bye,
everyone.
hon.
Bye,
Bye-bye. Thank
everybody.
Bye,
you. Of
everyone.
course.